Angiography. If ultrasound is not screening method for arterial insufficiency, could angiography serve as a first diagnostic method? Intravascular flow and inner wall is visualized with great preciseness. Unfortunately, safety and cost answer this question. Angiography won't be first step in evaluation of arterial system in outpatient clinic. Oximeter. Oximeter most frequently serves as a sensor of vital signs, and you are able to see this machine on the ICUs. Oximeter measure saturation of oxygen in tissue, and it is used for monitoring cardiovascular function. In case of cardiopulmonal failure, you are able to see change of oxygenation, and because oximeters is frequently combined with photoplethysmograph, you are able to detect heart frequency and its change in case of emergency. In severe case of arterial insufficiency, you should be able to see low oxygenation, but this represents so critical ischemia, which could be associated with loss of damaged tissue. Moderate and non-critical ischemia is not detectable by oximeter. Palpation of peripheral pulse. I am very often confronted with referrals from my colleagues on which palpation of peripheral pulse is described as a proof for good arterial flow or proof of appropriate investigation. Unfortunately, this is false myth. Palpation of peripheral pulse is unreliable, not reproducible, not sensitive, not specific, and not recommended. Palpation of peripheral pulse should be excluded from diagnostic methods in our office. Physiology of arterial flow. In previous slides, we tried to persuade the listener that ultrasound, arteriography, oximetry, and palpation is not suitable method for screening of arterial flow in outpatient clinic. How could we solve this puzzle? We should go again to physiology. Any oxygen available in tissues must be able to reach this area. There is a relationship of flow and oxygen availability. With limited flow, you will get less oxygen. With stenosis in artery, there must be decrease of blood pressure in area below the stenosis, which allows compensation of this stenosis. Severity of stenosis represents the size of blood pressure decrease. There is no better method in your clinic to diagnose arterial ischemia than blood pressure measurement. Segmental change of blood pressure. There are some facts we should know about blood pressure. There is a steady, continuous decrease of blood pressure distally. This decrease is up to 20 mm of lead. Pressure change is symmetrical on both extremities in any distal segment of extremities in comparison to previous proximal level. Segment represents area like thigh, arm, calf and forearm, and hand and foot. We often use this principle in diagnosis of peripheral vascular disease in measuring ankle brachial index. We know that the blood pressure should be almost equal in area of ankle and brachial artery. Any decrease of blood pressure bigger than expected could represent peripheral vascular disease. The same principle could be applied to any other segment in legs or hands. Any sudden decline of pressure is associated with loss of flow. This could be caused by emboli, atherosclerotic plaque, or any disease of arterial wall like vasculitis, and differential diagnosis is necessary. Practical measurement of blood pressure. The principle of using blood pressure as a tool of measuring blood flow is simple. Unfortunately, measuring blood pressure is not simple. We are taught measure the blood pressure as a routine procedure for diagnosis of hypertension in area of brachial artery. Stethoscope and sphygmomanometer is device appropriate for blood pressure measurement only in brachial area. In any different location is this method more difficult. In other localization you must use different technique of measurement. First of all, you must use different cuffs as the size of cuff matters. The remaining and maybe more difficult problem is to find appropriate tool for recording of blood pressure. Peripheral pocket continual Doppler is often used for measuring of blood pressure in level of wrist and ankle. Segments distally to wrist and ankle are not accessible by Doppler and you must use PPG method. It means photoplethysmographic probe. PPG method is reliable in small arteries almost to the distal end of fingers. A healthy patient has symmetrical blood pressure in both arms in corresponding levels with steady decline to the periphery. Example shows typical patient with decrease of blood pressure from 140 in brachial area to 80 mm of flat in area of fingers. With normal blood pressure, there can't be any flow pathology in a way of serious occlusion from any reason. On the picture you see the segments of extremities and appropriate levels of blood pressure with corresponding instruments used for blood pressure measurements. Look that we can measure the blood pressure in capillaries. Demonstration of measurement systolic pressure on finger arteries. This video represents measurement of finger blood systolic pressure with PPG probe. You should note placement of cuff, which is now placed in the area below metacarpal joint. PPG probe is attached to the tip of finger. Firstly, you will see graphical record of pulse, recorded with the help of PPG probe on monitor with deflated cuff. When cuff is inflated to the pressure higher than systolic pressure, graphical record of pulse disappear and you see flat line on monitor on screen. Then you start slowly decrease pressure of cuff until PPG probe will show again pulse on screen. First appearance of pulse wave on the screen represents the systolic pressure in artery under the cuff. Here this represents artery at proximal finger. Peripheral pocket Doppler. We should mention that there are two possibilities how to use portable Doppler on peripheral arterial system. The first and probably historically more important use was detection and grading of peripheral arterial stenosis performed in vascular laboratories. You would be able to detect the stenosis by measuring velocity of flow. This usage of portable Doppler is now replaced by duplex ultrasound because there were some limitations of this method. Second use of portable Doppler is now more common and it is represented by measuring ankle brachial index. We are using the portable Doppler only for location of tibial posterior artery. The sound of pulse, which is volume up by peripheral Doppler, is used in the same principle like sound in the stethoscope. If you would put the stethoscope above ankle. In our opinion, this method represents heavy demand for our outpatient clinic and we recommend the use of PPG probe attached on finger in appropriate localization instead of peripheral pocket Doppler. In our opinion, usage of peripheral pocket Doppler represents a heavy demand for our outpatient clinic and we recommend the use of PPG probe attached on finger and cuff attached in appropriate localization. PPG probe could perform measurement of systolic pressure more easily and cheaply with less space for human error. In previous slide we discussed that functional assessment of capillaries in a way of measuring blood pressure is not possible. On the other hand, we can visualize the capillaries directly by any scope, stereo microscope or video capillaroscope or simple magnifying glass or ophthalmoscope. In our case, stereo microscope is used for visualization of fingernail capillaries with help of cedar oil. Information achieved from fingernail bed serves mostly for diagnosis of inflammatory process in the wall of capillaries in rheumatological inflammatory diseases like scleroderma. Examination of eye capillaries with ophthalmoscope, which is practiced in many clinics, has different purpose. It helps in grading and diagnosis metabolic conditions like diabetes and hypertension. Purpose and diagnostical importance is different for eye and peripheral capillaries like finger. On the other hand, the same ophthalmoscope, which is used in GP clinic or in the eye department, could be used even in the area of nail bed with typical changes of capillaries in scleroderma. Capillaroscope is used for describing quantitative and qualitative change of capillaries. We are measuring the density of capillaries, it means number of capillaries in area, and describing pathological change in shape, size, and response of capillaries to any pathological stimuli. In a healthy person, there is a comb-like regular shape of capillaries which are very dense. In the early phase, at the beginning of disease like scleroderma, which will be investigated mostly for Raynaud syndrome, and in this early phase we see an increased size of capillaries which are called megacapillaries. In third phase, in active patient, you see damage of capillaries when the capillaries are destroyed and there is a reduction of their number and blood is leaking from damaged capillaries, which is seen as a hemorrhage on a nail bed. In late fourth phase, there is a regeneration and neoangiogenesis of destroyed capillaries with bushy-like shape of capillaries. Comparison of findings on capillaroscope. The simple stereomicroscope can demonstrate the differences between healthy control and patient with scleroderma. Healthy capillaries shows comb-like structure with a very uniform architecture with appropriate density. This is represented on the left picture. On the right picture you see the patient with scleroderma. Architecture of capillary shows irregularities of capillaries with their enlargement. There is a lower density of capillaries and some hemorrhage. We can call this stage as an active pattern of scleroderma. This picture is quite diagnostic, and if we see this on patient with Raynaud syndrome, we could be quite sure this patient has high probability of scleroderma.